Question 1. Implementation of a client's request for a specific, novel dietary supplement, for which robust scientific evidence of efficacy and safety is limited, requires the certified personal medicine coach to: Option A. Politely decline to discuss the supplement, stating that it falls outside the scope of personal medicine coaching and redirect the client to a medical doctor. Option B. Advise the client that the supplement is highly effective and likely to produce significant positive results, given the client's strong interest in it. Option C. Immediately incorporate the supplement into the client's regimen as requested, assuming the client has done their own research and is making an informed choice. Option D. Thoroughly research the supplement's available scientific literature, assess the quality of evidence, and transparently discuss potential benefits, risks, and the current state of research with the client before recommending any course of action. Correct answer is D. Thoroughly research the supplement's available scientific literature, assess the quality of evidence, and transparently discuss potential benefits, risks, and the current state of research with the client before recommending any course of action. Explanation: this scenario presents a professional challenge due to the inherent conflict between a client's expressed preferences and the coach's ethical obligation to provide evidence-based guidance. The Certified Personal Medicine Coach, CPMC, must navigate the client's desire for a specific, potentially unproven supplement with the responsibility to uphold scientific integrity and client well-being. The core tension lies in respecting client autonomy while ensuring that recommendations are grounded in safety and efficacy, as dictated by the ethical framework governing personal medicine coaching. The correct approach represents best professional practice because it prioritizes client safety and informed consent, aligning with the ethical principles of beneficence and non-maleficence. By thoroughly researching the supplement, consulting relevant scientific literature, and transparently communicating the findings, including potential risks and lack of robust evidence, the coach empowers the client to make a decision based on accurate information. This upholds the coach's duty of care and maintains professional integrity. An incorrect approach that solely defers to the client's request without due diligence fails to uphold the coach's responsibility to provide evidence-based guidance. This could lead to the client pursuing ineffective or even harmful interventions, violating the principle of non-maleficence. Another incorrect approach that dismisses the client's request outright, without exploring the underlying reasons or offering alternatives, demonstrates a lack of empathy and respect for client autonomy, potentially damaging the therapeutic relationship. An approach that exaggerates the potential benefits of the supplement, even if the client expresses interest, constitutes a breach of honesty and integrity, misrepresenting scientific evidence and potentially leading to false expectations and financial or health detriments. The professional decision-making process for similar situations involves a systematic evaluation. First, understanding the client's request and underlying motivations. Second, conducting thorough, evidence-based research on the proposed intervention. Third, transparently communicating findings, including benefits, risks, and the level of scientific support. Fourth, collaboratively discussing options and potential alternatives with the client. And finally, respecting the client's informed decision while continuing to offer support and monitor outcomes. Question 2. Quality control measures reveal that a certified personal medicine coach, CPMC, has a new client who, during their initial consultation, expresses a strong desire to focus exclusively on exercise intensity and duration, explicitly stating they do not want to discuss their current nutrition or sleep habits, despite the CPMC standard protocol for comprehensive lifestyle assessments. The client insists that these other areas are fine and not relevant to their goals. Option A. Immediately refuse to coach the client, stating that a comprehensive assessment is non-negotiable and that the client's refusal to engage in all aspects of the assessment violates professional standards. Option B. Insist on a full assessment of nutrition, exercise, and sleep before any exercise plan can be developed, explaining that it is a mandatory part of the coaching process and that the client must comply. Option C. Proceed with a detailed exercise assessment and plan, while gently reiterating the importance of nutrition and sleep for overall well-being and offering to revisit these topics at a later stage if the client becomes more open. Option D. Agree to the client's request and focus solely on exercise, developing a plan based only on the information provided about exercise intensity and duration, without any further inquiry into nutrition or sleep. The correct answer is C. Proceed with a detailed exercise assessment and plan, while gently reiterating the importance of nutrition and sleep for overall well-being and offering to revisit these topics at a later stage if the client becomes more open. Explanation. This scenario presents a professional challenge because it involves a conflict between a client's stated preferences and the Certified Personal Medicine Coach's (CPMC) professional judgment based on established lifestyle assessment guidelines. The CPMC must navigate this situation ethically and within the regulatory framework governing their practice, which emphasizes client well-being and evidence-based coaching. The correct approach represents best professional practice because it prioritizes the client's long-term health and safety by adhering to the established protocols for lifestyle assessments. This involves a thorough, unbiased evaluation of nutrition, exercise, and sleep patterns, and then collaboratively developing a plan that addresses identified areas for improvement. This aligns with the ethical obligation of a CPMC to provide competent and responsible guidance, ensuring that recommendations are grounded in best practices and are tailored to the individual's needs, rather than solely accommodating immediate, potentially detrimental client desires. The regulatory framework for CPMC mandates a holistic approach to lifestyle coaching, requiring coaches to utilize validated assessment tools and to guide clients towards sustainable health improvements. An incorrect approach that involves immediately agreeing to the client's request without a proper assessment fails to uphold the core responsibilities of a CPMC. This bypasses the essential step of gathering objective data on the client's current lifestyle habits, potentially leading to recommendations that are ineffective or even harmful. Ethically, this constitutes a failure to act in the client's best interest and a dereliction of professional duty. It also violates the implicit or explicit regulatory requirement for evidence-based practice and due diligence in client assessment. Another incorrect approach, which involves dismissing the client's preferences outright without attempting to understand the underlying reasons or explore alternatives, can damage the client-coach relationship and lead to non-adherence. While professional judgment is crucial, a lack of empathy and collaborative problem-solving is unprofessional and can be seen as a failure to meet the client where they are, which is a key component of effective coaching. This approach may also contravene guidelines that emphasize client-centered care and motivational interviewing techniques. The professional decision-making process for similar situations should involve 1. Actively listening to and acknowledging the client's stated preferences and concerns. 2. Explaining the importance of a comprehensive lifestyle assessment and the rationale behind the standard protocol. 3. Collaboratively exploring the client's motivations for their preferences and any potential barriers to a full assessment. 4. Gently guiding the client towards understanding how a thorough assessment will lead to more effective and personalized recommendations. 5. If the client remains resistant, exploring modified assessment approaches that still gather essential data while respecting some of their preferences, always prioritizing safety and efficacy. 6. Documenting the discussion and the agreed-upon approach. Question 3. Operational review demonstrates that a certified personal medicine coach, CPMC, is developing educational materials for clients regarding the historical development of personalized medicine. The coach is considering including detailed discussions of early, foundational research in pharmacogenomics from the mid-20th century, some of which predates current regulatory frameworks for clinical validation and data privacy. What approach best balances historical context with current professional responsibilities? Option A. Focus exclusively on the most recent advancements in personalized medicine, omitting any discussion of historical context to avoid confusion and ensure clients are only exposed to current, regulatory-approved information. Option B. Integrate historical scientific theories and findings directly into current recommendations, assuming that foundational research remains directly applicable to contemporary client guidance, without explicit mention of regulatory changes. Option C. Prioritize the historical narrative of scientific discovery, presenting early research findings as equally valid and authoritative as current, regulated personal medicine approaches, regardless of subsequent scientific validation or regulatory oversight. Option D. Emphasize the historical significance of early pharmacogenomic research as a stepping stone to modern personalized medicine, clearly delineating it from current, regulated practices and highlighting how regulatory bodies have evolved to ensure client safety and data integrity based on these historical lessons. The correct answer is D. Emphasize the historical significance of early pharmacogenomic research as a stepping stone to modern personalized medicine, clearly delineating it from current, regulated practices and highlighting how regulatory bodies have evolved to ensure client safety and data integrity based on these historical lessons. Explanation. This scenario presents a professional challenge because it requires a certified personal medicine coach, CPMC, to navigate the historical evolution of personal medicine while adhering strictly to the regulatory framework governing their practice. The challenge lies in distinguishing between historical scientific advancements and current, legally mandated standards of care and ethical considerations. A deep understanding of the historical context is crucial for appreciating the present landscape, but it must not lead to the adoption of outdated or non-compliant practices. The correct approach represents best professional practice because it acknowledges the historical trajectory of personal medicine, including the development of pharmacogenomics and personalized treatment strategies, while firmly grounding the coaching practice within the current regulatory framework for CPMC. This involves understanding how past research and discoveries have informed current guidelines and ethical standards, ensuring that advice and guidance provided are evidence-based, compliant with all applicable laws and regulations, and prioritize client safety and well-being according to contemporary standards. It demonstrates a commitment to continuous learning and ethical practice by integrating historical knowledge with present-day regulatory requirements. An incorrect approach that relies solely on historical scientific theories without considering current regulatory mandates would be a significant ethical and regulatory failure. For instance, referencing early, unvalidated theories of genetic predisposition to disease without acknowledging the rigorous validation processes and regulatory approvals required for current diagnostic and therapeutic applications would be misleading and potentially harmful to clients. Another failure would be to suggest or implement personalized medicine strategies based on historical research that has since been superseded by more accurate, evidence-based methodologies, or that do not meet current standards for data privacy and informed consent as dictated by the relevant regulatory bodies. Such an approach would violate the principle of providing competent and up-to-date guidance, potentially exposing clients to ineffective or even harmful interventions and breaching professional standards of care. The professional decision-making process for similar situations should involve a critical evaluation of historical information through the lens of current regulatory compliance and ethical best practices. Professionals must ask, does this historical insight align with current legal requirements, ethical guidelines, and evidence-based standards of practice for a CPMC? This requires ongoing professional development, staying abreast of regulatory updates, and critically assessing the applicability of historical knowledge to contemporary client care. The focus must always be on providing safe, effective, and compliant guidance that respects the client's autonomy and well-being within the established legal and ethical boundaries of the profession. Question 4. The efficiency study reveals that a certified personal medicine coach, CPMC, is developing personalized health strategies for clients. Which of the following best defines the core principles of personal medicine as applied by a CPMC within their regulatory framework? Option A. Providing generalized health advice that applies to the broader population without deep consideration of individual data. Option B. Tailoring interventions to the individual, utilizing predictive and preventive strategies, and empowering clients with actionable insights derived from their unique biological and lifestyle data. Option C. Focusing exclusively on genetic predispositions to identify potential health risks, regardless of other contributing factors. Option D. Making definitive diagnoses and prescribing specific medical treatments based on a client's genetic profile. Correct answer is B. Tailoring interventions to the individual, utilizing predictive and preventive strategies, and empowering clients with actionable insights derived from their unique biological and lifestyle data. Explanation. The efficiency study reveals that a certified personal medicine coach, CPMC, is tasked with developing personalized health strategies for clients based on their unique genetic predispositions, lifestyle factors, and environmental exposures. The challenge lies in accurately defining and applying the principles of personal medicine within the strict regulatory framework governing health coaching, ensuring client safety, data privacy, and adherence to evidence-based practices. The CPMC must navigate the complexities of interpreting individual data without overstepping professional boundaries or making unsubstantiated claims, all while maintaining client autonomy and informed consent. The correct approach emphasizes the core principles of personal medicine, tailoring interventions to the individual, utilizing predictive and preventive strategies, and empowering clients with actionable insights derived from their unique biological and lifestyle data. This aligns with the regulatory expectation for CPMC to operate within their scope of practice, promoting health and well-being through evidence-informed guidance. It respects the client's role as an active participant in their health journey, fostering a collaborative relationship built on trust and transparency. This approach upholds the ethical imperative to provide accurate, personalized, and actionable advice, ensuring that the strategies developed are both safe and effective for the individual client. An incorrect approach that focuses solely on genetic data without considering lifestyle and environmental factors fails to embrace the holistic nature of personal medicine, potentially leading to incomplete or misleading recommendations. This could violate ethical principles by not providing a comprehensive view of the client's health landscape. Another incorrect approach that involves making definitive diagnoses or prescribing treatments would directly contravene the regulatory boundaries of a CPMC, as these actions are reserved for licensed medical professionals. This constitutes a significant regulatory and ethical failure, potentially endangering the client and exposing the coach to legal repercussions. A third incorrect approach that prioritizes generalized advice over individualized strategies ignores the fundamental definition of personal medicine, rendering the coaching ineffective and failing to meet the client's specific needs. This represents a failure to adhere to the core principles of the profession and the client's right to personalized care. Professionals should approach such situations by first thoroughly understanding the client's complete health profile, integrating all available data, genetic, lifestyle, environmental. They must then apply the principles of personal medicine by identifying individual risk factors and opportunities for optimization, translating this information into personalized, actionable, and evidence-based recommendations. Crucially, they must operate strictly within their defined scope of practice, collaborating with healthcare providers when necessary, and always prioritizing client safety, autonomy, and informed consent. Continuous professional development and adherence to regulatory guidelines are paramount. Question 5. Investigation of how a certified personal medicine coach can most effectively foster a client's self-efficacy to promote sustainable behavior change regarding medication adherence, considering the client expresses significant doubt about their ability to manage a new, complex medication regimen. Option A. Reassure the client by stating that the new medication regimen is straightforward and that they should not have difficulty managing it, implying their doubts are unfounded. Option B. Collaboratively explore the client's past successes in managing health challenges, identify their existing coping strategies, and co-create small, achievable steps within the new regimen that build upon these strengths. Option C. Offer the client external incentives, such as gift cards or discounts, for successfully adhering to the medication schedule for a specified period. Option D. Provide the client with a detailed, step-by-step action plan for medication adherence, including strict daily schedules and consequences for non-compliance, emphasizing the coach's role in ensuring adherence. The correct answer is B. Collaboratively explore the client's past successes in managing health challenges, identify their existing coping strategies, and co-create small, achievable steps within the new regimen that build upon these strengths. Explanation. This scenario is professionally challenging because it requires the certified personal medicine coach, CPMC, to navigate the delicate balance between empowering a client and overstepping professional boundaries, particularly concerning the client's intrinsic motivation and self-belief. The core of the challenge lies in fostering self-efficacy, a key determinant of behavior change, without resorting to prescriptive or coercive tactics that could undermine the client's autonomy and long-term adherence. The CPMC must operate strictly within the ethical guidelines and regulatory framework of the Certified Personal Medicine Coach designation, which emphasizes client-centered approaches and evidence-based coaching practices. The correct approach represents best professional practice because it directly addresses the client's perceived ability to succeed by collaboratively identifying past successes and building upon existing strengths. This aligns with the principles of self-efficacy theory, which posits that individuals are more likely to engage in and persist with behaviors if they believe they can successfully perform them. By focusing on the client's internal resources and past achievements, the CPMC is fostering a sense of mastery and competence, thereby enhancing self-efficacy. This approach is ethically sound as it respects client autonomy and promotes self-determination, key tenets of professional coaching. It also adheres to the implicit regulatory expectation for CPMC to facilitate sustainable behavior change through empowering the client, rather than imposing external solutions. An incorrect approach that focuses solely on providing external motivators or rewards fails to address the root of self-efficacy. This is ethically problematic as it can create dependency and may not lead to sustained behavior change once the external motivators are removed. It also risks undermining the client's intrinsic motivation and sense of personal agency. From a regulatory perspective, such an approach might be seen as not adhering to best practices for fostering long-term client empowerment and self-management, which are often implicit or explicit in professional coaching standards. Another incorrect approach that involves the CPMC dictating specific actions and timelines without client input is ethically unsound because it disregards client autonomy and can lead to feelings of coercion. This directly contradicts the principles of client-centered coaching and can significantly damage the client's self-efficacy by implying they are incapable of making their own decisions or managing their progress. This approach also fails to align with the regulatory expectation for coaches to facilitate self-discovery and skill building, rather than acting as a directive authority. A third incorrect approach that dismisses the client's concerns about their ability to change by simply stating they should be able to, or that it's not that hard, is ethically negligent. This invalidates the client's feelings and experiences, which is detrimental to building trust and rapport. It also directly attacks the foundation of self-efficacy by failing to acknowledge potential barriers or perceived limitations. This approach is professionally unacceptable as it lacks empathy and fails to provide constructive support, potentially leading to client disengagement and a negative coaching experience, which would be contrary to the spirit and likely the letter of professional coaching regulations. The professional decision-making process for similar situations should involve a thorough assessment of the client's current self-efficacy beliefs. This includes actively listening to their concerns, exploring their past experiences with similar challenges, and identifying their perceived strengths and weaknesses. The CPMC should then collaboratively develop strategies that build upon these strengths and address perceived barriers in a way that enhances the client's sense of control and competence. This process should be iterative, with regular check-ins to assess progress and adjust strategies as needed, always prioritizing client autonomy and empowerment. Question 6. What factors determine the most appropriate approach for a certified personal medicine coach when a patient expresses significant reservations about a recommended lifestyle modification, despite the coach believing it to be clinically beneficial? Option A. The ease with which the lifestyle modification can be implemented, prioritizing practicality over the patient's individual preferences. Option B. The extent to which the lifestyle modification aligns with general public health recommendations, even if it conflicts with the patient's unique situation. Option C. The patient's stated values, personal circumstances, and expressed concerns, alongside the coach's assessment of the modification's potential impact on the patient's overall well-being and adherence. Option D. The perceived clinical efficacy of the lifestyle modification as determined by the coach's professional opinion, irrespective of the patient's personal beliefs. Correct answer is C. The patient's stated values, personal circumstances, and expressed concerns, alongside the coach's assessment of the modification's potential impact on the patient's overall well-being and adherence. Explanation. This scenario is professionally challenging because it requires balancing a patient's expressed preferences with the coach's professional judgment and the established guidelines for personal medicine. The core of the challenge lies in navigating the nuances of shared decision-making, ensuring the patient feels heard and empowered, while also upholding the principles of safe and effective personal medicine coaching. Careful judgment is required to avoid paternalism or undue influence, and to foster a collaborative partnership. The correct approach represents best professional practice because it prioritizes the patient's autonomy and values as the central drivers of the decision-making process. This aligns with the fundamental ethical principles of patient-centered care and shared decision-making, which are cornerstones of the Certified Personal Medicine Coach (CPMC) framework. By actively listening to the patient's concerns, exploring their rationale, and collaboratively developing a plan that respects their lifestyle and beliefs, the coach fosters trust and adherence. This approach is ethically sound, as it respects the patient's right to self-determination and is consistent with the regulatory expectation that coaches facilitate informed choices rather than dictate them. An incorrect approach that focuses solely on the coach's perceived best medical outcome, disregarding the patient's expressed preferences, represents a failure in patient-centered care. This paternalistic stance undermines the patient's autonomy and can lead to resentment and non-adherence, violating ethical guidelines that mandate respecting patient values. Another incorrect approach that involves pressuring the patient to adopt a specific regimen without fully exploring their concerns or offering alternatives demonstrates a lack of empathy and a failure to engage in genuine shared decision-making. This can be seen as coercive and is contrary to the collaborative spirit expected of a personal medicine coach. Finally, an approach that dismisses the patient's concerns as irrelevant or misinformed without proper investigation and discussion fails to acknowledge the patient's lived experience and their right to participate in decisions about their health. This can lead to a breakdown in the therapeutic relationship and a failure to achieve the patient's personal health goals. Professionals should employ a decision-making framework that begins with active listening to understand the patient's perspective, values, and goals. This should be followed by providing clear, understandable information about available options, including potential benefits and risks, tailored to the patient's comprehension level. The next step involves exploring the patient's preferences and concerns in relation to these options, facilitating a dialogue where the patient can express their thoughts and feelings without judgment. Finally, the coach and patient collaboratively develop a personalized plan that aligns with the patient's values and goals, with a commitment to ongoing review and adjustment. Question 7. When evaluating a client's expressed reluctance to start a new medication prescribed by their physician, which motivational interviewing technique best supports the client's autonomy and adherence within the scope of a certified personal medicine coach? Option A. Advise the client that the medication is essential for their health and they should take it as prescribed by the doctor. Option B. Suggest that the client might be overthinking the situation and encourage them to simply follow the doctor's instructions without further questioning. Option C. Offer your own opinion on the medication's effectiveness based on general knowledge and encourage the client to consider your perspective. Option D. Ask open-ended questions about the client's thoughts and feelings regarding the medication and reflect their statements to encourage further exploration of their concerns and potential benefits. The correct answer is D. Ask open-ended questions about the client's thoughts and feelings regarding the medication and reflect their statements to encourage further exploration of their concerns and potential benefits. Explanation. This scenario is professionally challenging because it requires the Certified Personal Medicine Coach, CPMC, to navigate a client's resistance to a prescribed medication while adhering to their scope of practice and ethical guidelines. The CPMC must balance the client's autonomy and concerns with the medical advice provided by the prescribing physician. The core challenge lies in using motivational interviewing techniques to explore the client's ambivalence without overstepping into medical advice or diagnosis, which falls outside the CPMC jurisdiction. The correct approach represents best professional practice because it directly applies motivational interviewing principles to explore the client's perspective and barriers to adherence. By asking open-ended questions about their thoughts and feelings regarding the medication and reflecting their statements to ensure understanding, the CPMC facilitates the client's own exploration of their readiness for change. This aligns with the ethical imperative to empower clients and support their decision-making process within the bounds of their personal medicine plan. The regulatory framework for CPMC emphasizes client-centered support and education, not medical directive. This approach respects the client's autonomy and fosters a collaborative relationship, which is crucial for long-term adherence and well-being. An incorrect approach that involves directly advising the client to take the medication or suggesting they disregard the doctor's orders would represent a significant regulatory and ethical failure. This constitutes practicing medicine without a license and overstepping the defined scope of a CPMC. It undermines the physician-patient relationship and could lead to adverse health outcomes for the client. Another incorrect approach, such as dismissing the client's concerns as unfounded or simply reiterating the doctor's instructions without exploration, fails to utilize motivational interviewing effectively. This can alienate the client, increase resistance, and prevent the identification of underlying barriers to adherence, thus violating the principle of client-centered support. The professional decision-making process for similar situations involves a clear understanding of the CPMC scope of practice, ethical obligations, and the specific principles of motivational interviewing. When faced with client ambivalence or resistance, the CPMC should first acknowledge and validate the client's feelings. Then, they should employ open-ended questions to explore the client's perspective, using reflective listening to demonstrate understanding. The goal is to help the client articulate their own reasons for change and to identify their own solutions, rather than imposing external directives. If the client's concerns involve medical efficacy or side effects, the CPMC role is to facilitate a discussion with the prescribing physician, not to offer medical opinions or advice. Question 8. Risk assessment procedures indicate a client is expressing significant reluctance and doubt regarding a newly prescribed medication, stating, "I'm not sure I want to take this. It sounds like a lot of side effects, and I don't know if it will even help." As a certified personal medicine coach, how should you best address this situation to support the client's journey towards optimal health and adherence? Option A. Reassure the client that they do not need to take the medication if they are uncomfortable, and focus the coaching session on unrelated lifestyle changes to avoid conflict. Option B. Firmly explain that as their coach, you expect them to follow their doctor's orders precisely, and that their reluctance is hindering their progress, demanding they take the medication as prescribed. Option C. Immediately advise the client to stop taking the medication and suggest they explore over-the-counter remedies that might offer similar benefits without the perceived risks. Option D. Acknowledge the client's feelings and concerns. Explore their understanding of the medication's purpose and potential benefits, and gently inquire about their readiness to discuss strategies for managing potential side effects or moving forward with the prescription in consultation with their physician. The correct answer is D. Acknowledge the client's feelings and concerns, explore their understanding of the medication's purpose and potential benefits, and gently inquire about their readiness to discuss strategies for managing potential side effects or moving forward with the prescription in consultation with their physician. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to navigate a client's resistance to a prescribed medication, which directly impacts the client's health outcomes and adherence to a medical treatment plan. The CPMC must balance supporting the client's autonomy and understanding with the imperative of ensuring they follow medical advice for their well-being, all within the defined scope of practice for a CPMC. The risk lies in either overstepping professional boundaries by dictating medical choices or failing to adequately support the client in understanding and engaging with their prescribed treatment, potentially leading to adverse health consequences. Correct approach analysis. The correct approach involves acknowledging the client's feelings and concerns, validating their experience, and then gently guiding them back to understanding the rationale behind the prescribed medication and exploring their readiness to engage with it. This aligns with the principles of motivational interviewing and the stages of change model, specifically addressing pre-contemplation or contemplation. A CPMC role is to empower clients to make informed decisions about their health, not to make those decisions for them. By exploring the client's ambivalence, the coach facilitates self-reflection and can help the client move towards preparation or action. This approach respects client autonomy while upholding the ethical responsibility to support adherence to medically recommended treatments, as per CPMC guidelines, which emphasize client-centered support and education within the scope of coaching. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns and insisting on immediate adherence to the medication. This fails to acknowledge the client's current stage of change, likely pre-contemplation or contemplation, and can lead to increased resistance, damaged rapport, and a breakdown in the coaching relationship. Ethically, it violates the principle of client autonomy and can be seen as coercive, overstepping the CPMC role by dictating medical compliance rather than facilitating understanding and readiness. Another incorrect approach is to immediately suggest discontinuing the medication or exploring alternative treatments, without consulting the prescribing physician. This is a significant regulatory and ethical failure, as it directly encroaches on the scope of practice of a licensed medical professional. A CPMC is not qualified to make medical judgments about medication efficacy or safety. This action could lead to serious health risks for the client and expose the coach to legal and professional repercussions for practicing medicine without a license. A third incorrect approach is to simply agree with the client's reluctance and avoid discussing the medication altogether. While seemingly supportive, this approach fails to address the underlying health issue and the potential benefits of the prescribed treatment. It neglects the CPMC responsibility to help clients engage with their health goals, which in this case involves understanding and potentially adhering to a prescribed medical intervention. This passive stance can inadvertently reinforce the client's resistance and hinder their progress towards better health outcomes. Professional reasoning. Professionals should employ a decision-making process that prioritizes client well-being, respects autonomy, and operates strictly within their defined scope of practice. This involves active listening to understand the client's perspective, validating their feelings, and then using evidence-based coaching techniques, like motivational interviewing, to explore their readiness for change. When medical decisions are involved, the process must include clear communication about the importance of consulting with their healthcare provider and ensuring the client understands the rationale and implications of their medical treatment plan. The CPMC role is to facilitate the client's engagement with their healthcare team and their own health journey, not to replace the physician or dictate medical choices. Question 9. Cost-benefit analysis shows that integrating personalized nutritional strategies into chronic disease management plans can significantly improve patient outcomes and reduce long-term healthcare expenditures. As a certified personal medicine coach, CPMC, what is the most appropriate initial step when a client with a newly diagnosed chronic condition, such as type 2 diabetes, expresses a strong desire to manage their condition primarily through diet? Option A. Advise the client to immediately discontinue all prescribed medications and focus exclusively on a strict ketogenic diet, as this has shown rapid results in some anecdotal reports. Option B. Suggest the client research various popular fad diets online and choose one that appeals to them, assuring them that any dietary change will be beneficial. Option C. Contact the client's primary care physician to discuss the client's interest in dietary management and to obtain their current treatment plan and any specific dietary recommendations or contraindications before developing any personalized coaching strategies. Option D. Recommend a comprehensive, evidence-based nutritional plan tailored to type 2 diabetes management, emphasizing whole foods and glycemic control, and schedule a follow-up to monitor progress and adjust as needed. The correct answer is D. Recommend a comprehensive, evidence-based nutritional plan tailored to type 2 diabetes management, emphasizing whole foods and glycemic control, and schedule a follow-up to monitor progress and adjust as needed. Explanation. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to navigate the complex interplay between individual patient needs, established medical guidelines, and the practicalities of implementing nutritional interventions for chronic disease management. The CPMC must balance the potential benefits of personalized dietary advice with the risks of overstepping professional boundaries or providing advice that is not evidence-based or aligned with the patient's overall medical treatment plan. Careful judgment is required to ensure that nutritional recommendations are supportive of, rather than contradictory to, the patient's prescribed medical care. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-informed strategy. By consulting with the patient's primary care physician and adhering to established nutritional guidelines for chronic diseases, the CPMC ensures that their recommendations are safe, effective, and integrated into the patient's comprehensive care. This aligns with the ethical obligation of a CPMC to act in the best interest of the client, to practice within their scope of competence, and to work collaboratively with other healthcare professionals. Regulatory frameworks for health coaching often emphasize the importance of interdisciplinary collaboration and evidence-based practice to protect client well-being and maintain professional integrity. An incorrect approach that focuses solely on anecdotal evidence or unverified dietary trends would be a significant regulatory and ethical failure. This could lead to the client discontinuing or altering prescribed medical treatments based on unsubstantiated advice, potentially worsening their chronic condition and violating the principle of do no harm. Furthermore, providing advice outside of established, evidence-based nutritional science for chronic diseases could be considered practicing medicine without a license or exceeding the scope of practice for a CPMC, depending on the specific regulatory definitions within the CPMC framework. Another incorrect approach that relies on a one-size-fits-all dietary plan, without considering the individual's specific chronic condition, comorbidities, or personal preferences, would also be professionally unacceptable. This fails to acknowledge the personalized nature of medicine and nutrition, potentially leading to ineffective interventions or adverse effects. Ethically, it demonstrates a lack of client-centered care. The professional decision-making process for similar situations should involve a clear understanding of the CPMC scope of practice, a commitment to evidence-based interventions, and a strong emphasis on interprofessional collaboration. When faced with a client seeking nutritional guidance for a chronic disease, the CPMC should first ascertain the client's current medical management plan and then engage in open communication with the client's physician. Recommendations should be grounded in established scientific literature and tailored to the individual's unique circumstances, always with the goal of supporting the overall health and well-being of the client within the established medical framework. Question 10. Process analysis reveals a certified personal medicine coach, CPMC, is working with a client who expresses a strong interest in adopting a highly restrictive, trendy diet for chronic disease prevention, citing anecdotal evidence from social media. The client is otherwise generally healthy, but has a family history of cardiovascular disease. The CPMC has reviewed the client's current dietary habits and lifestyle, which are moderately healthy but could be improved. The CPMC professional judgment suggests that while the client's interest in proactive health is commendable, the proposed diet lacks robust scientific backing for long-term chronic disease prevention and may not be sustainable or nutritionally complete. How should the CPMC proceed? Option A. Advise the client to consult with a medical doctor or registered dietitian for dietary advice, stating that as a CPMC, they are not qualified to provide guidance on specific dietary interventions for chronic disease prevention. Option B. Enthusiastically endorse the client's interest in the trendy diet, encouraging them to pursue it vigorously as a means of chronic disease prevention, and offer to help them track their adherence to its specific protocols. Option C. Acknowledge the client's interest in proactive health, discuss the evidence-based benefits and risks of various personalized chronic disease prevention strategies, including sustainable dietary patterns and lifestyle modification, and collaboratively develop a plan that aligns with scientific understanding and the client's individual needs and preferences. Option D. Immediately dismiss the client's interest in the trendy diet, explaining that it is not scientifically supported and potentially harmful, and present a standard, evidence-based dietary guideline without further exploration of the client's specific motivations or concerns. The correct answer is C. Acknowledge the client's interest in proactive health, discuss the evidence-based benefits and risks of various personalized chronic disease prevention strategies, including sustainable dietary patterns and lifestyle modifications, and collaboratively develop a plan that aligns with scientific understanding and the client's individual needs and preferences. Explanation. This scenario presents a professional challenge because it requires the certified personal medicine coach, CPMC, to balance a client's expressed preferences with evidence-based recommendations for chronic disease prevention, all while operating within the ethical and regulatory framework of the CPMC designation. The core tension lies in respecting client autonomy versus guiding them towards scientifically supported interventions. The correct approach prioritizes a collaborative and educational strategy. It involves thoroughly understanding the client's personal history, lifestyle, and preferences, then presenting evidence-based personalized strategies for chronic disease prevention in a clear, accessible manner. This approach respects client autonomy by empowering them with information to make informed decisions. It aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm by not promoting ineffective or potentially harmful practices. Regulatory frameworks for health coaching, while not prescribing specific medical treatments, generally emphasize evidence-informed practice and client-centered care, which this approach embodies. An incorrect approach would be to dismiss the client's expressed interest in a particular dietary trend, without adequate exploration or explanation. This could be seen as paternalistic and disrespectful of client autonomy, potentially alienating the client and hindering their engagement with more beneficial, evidence-based strategies. Ethically, it fails to fully explore the client's motivations and concerns. From a regulatory perspective, while not directly violating a specific law, it falls short of best practices in client engagement and education. Another incorrect approach would be to immediately endorse the client's interest in an unproven or potentially harmful dietary trend, without critical evaluation. This would be a significant ethical failure, violating the principle of non-maleficence by potentially exposing the client to harm or ineffective interventions. It also undermines the professional's role as a guide towards evidence-based health practices and could have regulatory implications if the coaching practice is found to be promoting unsubstantiated health claims. A third incorrect approach would be to provide a generic, one-size-fits-all prevention plan without considering the client's unique circumstances or preferences. This fails to deliver on the personalized aspect of the coaching role and may not be effective or sustainable for the individual. Ethically, it is less effective than a tailored approach and may not fully address the client's specific risks or needs. The professional decision-making process for similar situations should involve a structured approach. 1. Active listening and empathy. Fully understand the client's perspective, concerns, and motivations. 2. Information gathering. Collect comprehensive data about the client's health history, lifestyle, and preferences. 3. Evidence-based education. Present relevant, scientifically supported information about chronic disease prevention strategies, explaining the rationale behind recommendations. 4. Collaborative goal setting. Work with the client to develop realistic, personalized, and achievable goals. 5. Ongoing support and adaptation. Regularly review progress. Provide encouragement and adjust the plan as needed based on client feedback and evolving evidence. 6. Ethical boundary awareness. Always operate within the scope of practice for a CPMC, referring to medical professionals when necessary. Question 11. The evaluation methodology shows that a certified personal medicine coach's client, who had enthusiastically agreed to a detailed action plan for managing their health, is now expressing significant difficulty in adhering to it due to unexpected work-related stress and family emergencies. Which of the following represents the most professionally sound and ethically compliant approach for the coach to take? Option A. Facilitate a collaborative discussion with the client to understand the specific barriers, reevaluate the feasibility of the current action plan in light of their new circumstances, and jointly adjust the goals and steps to be more achievable and relevant, while reinforcing the client's agency. Option B. Provide the client with a list of general stress management techniques and encourage them to find one that might fit their situation, without delving into the specifics of their action plan or their current challenges. Option C. Emphasize the importance of discipline and commitment, reminding the client of their initial agreement and encouraging them to push through the difficulties to stick to the original action plan as closely as possible. Option D. Suggest that the client temporarily abandon the current action plan and focus solely on managing their immediate stressors, with the understanding that a new plan can be developed once their life stabilizes. The correct answer is A. Facilitate a collaborative discussion with the client to understand the specific barriers, reevaluate the feasibility of the current action plan in light of their new circumstances, and jointly adjust the goals and steps to be more achievable and relevant, while reinforcing the client's agency. Explanation. Scenario analysis. This scenario presents a common implementation challenge in personal medicine coaching. A client's initial enthusiasm for a meticulously crafted action plan wanes due to unforeseen life events. The challenge lies in balancing the structured approach of goal setting and action planning with the dynamic and often unpredictable nature of a client's life. A coach must demonstrate adaptability and empathy without compromising the integrity of the coaching process or the client's agency. The risk is either rigidly adhering to the plan, alienating the client, or abandoning the plan entirely, undermining the progress and the client's commitment. Correct approach analysis. The correct approach involves a collaborative reevaluation and adjustment of the action plan. This aligns with best professional practice by prioritizing the client's current circumstances and empowering them to take ownership of their journey. Specifically, it upholds the ethical principle of client-centeredness, ensuring that the plan remains relevant and achievable for the individual. It also reflects a commitment to the principles of SMART, specific, measurable, achievable, relevant, time-bound goal setting, acknowledging that the achievable and relevant components may need recalibration. This approach fosters trust and reinforces the coach-client partnership, essential for sustained progress. Incorrect approaches analysis. One incorrect approach involves rigidly insisting the client adhere to the original plan despite their stated difficulties. This fails to acknowledge the client's lived experience and can be perceived as dismissive, potentially damaging the therapeutic alliance. Ethically, it violates the principle of beneficence by not acting in the client's best interest, as the plan is no longer serving them effectively. It also undermines the client's autonomy by not respecting their current capacity. Another incorrect approach is to immediately discard the entire action plan and start over without a thorough discussion. This demonstrates a lack of structured coaching methodology and can lead to a feeling of instability for the client. It suggests that the initial planning was flawed or that the coach is not equipped to handle minor setbacks, potentially eroding the client's confidence in the coaching process. It also fails to leverage the learning from the initial plan's development. A third incorrect approach is to offer generic, unspecific advice without understanding the root cause of the client's disengagement. This lacks the depth required for effective personal medicine coaching, which is built on personalized strategies. It fails to address the specific barriers the client is facing and does not involve the client in finding solutions, thus not fostering self-efficacy. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and validating their feelings. The next step is to collaboratively explore the reasons for the deviation from the plan, identifying specific barriers and challenges. Based on this understanding, the coach and client should jointly review the existing goals and action steps, determining what needs to be modified, postponed, or replaced. This process should always aim to keep the goals relevant and achievable within the client's current context, reinforcing their agency and commitment to their personal medicine journey. Question 12. Operational review demonstrates that a certified personal medicine coach's client, who has been diagnosed with prediabetes, understands the health risks associated with their current lifestyle and the benefits of adopting a healthier diet and increasing physical activity. However, the client consistently expresses a lack of motivation and finds it difficult to implement the recommended changes, often reverting to old habits after brief periods of adherence. The coach has provided educational materials and discussed the rationale behind the recommendations multiple times. Which of the following coaching approaches would be most effective in addressing the client's persistent ambivalence and fostering sustainable behavior change, aligning with best practices for certified personal medicine coaches? Option A. Implement a reward system where the client earns points for adherence to the diet and exercise plan, with tangible prizes awarded for achieving weekly milestones. Option B. Increase the frequency of educational sessions, providing more detailed information on the physiological impacts of poor lifestyle choices and the specific nutritional content of healthier foods. Option C. Adopt a more directive approach, clearly outlining the non-negotiable steps the client must take and expressing concern about the potential negative health consequences if they fail to comply. Option D. Focus on exploring the client's personal values and goals, empowering them to identify their own reasons for change, and supporting their sense of autonomy and competence in making choices that align with their aspirations. The correct answer is D. Focus on exploring the client's personal values and goals, empowering them to identify their own reasons for change, and supporting their sense of autonomy and competence in making choices that align with their aspirations. Explanation. Scenario analysis. This scenario presents a common challenge for personal medicine coaches. A client exhibiting resistance to adopting recommended lifestyle changes despite understanding the rationale. The coach must navigate the client's ambivalence and internal barriers without overstepping professional boundaries or resorting to coercive tactics. The challenge lies in applying behavior change theories effectively and ethically, respecting client autonomy while guiding them towards improved health outcomes. Correct approach analysis. The most effective approach involves leveraging self-determination theory, SDT, by focusing on fostering the client's intrinsic motivation. This means exploring the client's personal values and goals related to the recommended changes, empowering them to make choices that align with their sense of self, and providing opportunities for them to feel competent and connected. By supporting autonomy, competence, and relatedness, the coach helps the client develop a genuine desire to change, leading to more sustainable outcomes. This aligns with the ethical principles of client-centered care and promoting self-efficacy, which are foundational to the Certified Personal Medicine Coach (CPMC) role. Incorrect approaches analysis. One incorrect approach would be to solely rely on external motivators, such as offering rewards or imposing penalties. This strategy, rooted in operant conditioning, can lead to short-term compliance but often fails to foster lasting change. Ethically, it can undermine client autonomy by creating a dependency on external validation and may not align with the CPMC mandate to empower individuals for long-term well-being. Another incorrect approach would be to adopt a directive, authoritative stance, telling the client exactly what they must do and dismissing their concerns. This approach, which might stem from a misunderstanding of motivational interviewing or a paternalistic mindset, disregards the client's lived experience and capacity for self-direction. It violates the principle of respecting client autonomy and can damage the therapeutic alliance, leading to increased resistance and disengagement. A third incorrect approach would be to focus exclusively on the cognitive aspects of change, such as providing more information or educational materials, without addressing the underlying behavioral and emotional barriers. While knowledge is important, it is often insufficient for behavior change. This approach fails to acknowledge the complexity of human behavior and the importance of psychological factors like self-efficacy, perceived barriers, and emotional readiness, which are central to effective coaching. Professional reasoning. When faced with client resistance, a CPMC should first engage in active listening to understand the client's perspective and identify the root of their ambivalence. They should then collaboratively explore the client's values and goals, linking the recommended changes to what is personally meaningful to the client. The coach should offer choices and support the client's sense of agency, providing opportunities for small successes to build competence. This process of collaborative exploration and empowerment, guided by principles of motivational interviewing and behavior change theories like SDT, is crucial for fostering sustainable positive change and upholding professional standards. Question 13. The control framework reveals that a certified personal medicine coach, CPMC, is working with a client who expresses a desire to increase their physical activity but struggles with motivation and consistency. The coach is considering how to best guide this client. Which of the following approaches demonstrates the most effective and ethically sound application of behavior change models in this scenario? Option A. Begin by assessing the client's perceived susceptibility to health risks and the perceived benefits of exercise, then tailor interventions based on their responses within the health belief model framework. Option B. Immediately introduce the stages of change from the trans-theoretical model and guide the client through each stage, assuming they are ready to progress through them sequentially. Option C. Present the client with a comprehensive overview of all major behavior change models and allow them to choose which one they feel most drawn to without providing guidance on their suitability. Option D. Conduct an initial assessment to understand the client's current stage of readiness for change and their underlying beliefs and motivations. Then select and adapt a behavior change model, such as the trans-theoretical model or health belief model, that best fits the client's individual profile and goals. The correct answer is A. Begin by assessing the client's perceived susceptibility to health risks and the perceived benefits of exercise. Then tailor interventions based on their responses within the health belief model framework. Explanation. This scenario presents a professional challenge because a certified personal medicine coach, CPMC, must apply theoretical behavior change models to a real-world client situation without overstepping professional boundaries or making unsubstantiated claims. The core difficulty lies in accurately assessing a client's readiness for change and selecting the most appropriate model to guide the coaching process, all while adhering to the ethical and regulatory guidelines of the CPMC certification. The impact assessment requires understanding how different models can influence client engagement and outcomes, necessitating a nuanced approach rather than a one-size-fits-all application. The correct approach represents best professional practice because it prioritizes a client-centered assessment to determine the most suitable behavior change model. This aligns with the ethical imperative for CPMC to practice within their scope and to tailor interventions to individual needs. By first understanding the client's current stage of change and their beliefs about health. The coach can then select a model that resonates with the client and is most likely to facilitate sustainable change. This respects client autonomy and promotes effective coaching, as mandated by the Principles of Professional Conduct for CPMC. An incorrect approach that focuses solely on the transtheoretical model, TTM, without initial client assessment fails to acknowledge that not all clients will fit neatly into its stages. This could lead to misapplication, frustration for the client, and a lack of progress, potentially violating the ethical duty to provide competent and effective coaching. Another incorrect approach that exclusively uses the health belief model, HBM, might overlook the client's readiness for action, focusing too much on perceived threats and benefits without considering their current behavioral stage. This can be ineffective if the client is not yet convinced of the need for change or is not ready to take action. A third incorrect approach that attempts to combine multiple models without a clear rationale or client-specific justification risks overwhelming the client and diluting the effectiveness of any single model. This lacks the precision and focus required for effective behavior change coaching and could be seen as unprofessional practice. The professional decision-making process for similar situations involves a systematic approach. 1. Client assessment. Begin with a thorough understanding of the client's current situation, including their goals, challenges, beliefs, and readiness for change. 2. Model selection. Based on the assessment, identify which behavior change model S are most relevant and likely to be effective for this specific client. 3. Tailored application. Adapt the chosen model S to the client's unique circumstances, ensuring the coaching interventions are personalized. 4. Ongoing evaluation. Continuously monitor the client's progress and adjust the coaching approach as needed, remaining flexible and responsive to their evolving needs. 5. Ethical adherence. Throughout the process, ensure all actions align with the CPMC Code of Ethics and relevant regulatory guidelines. Question 14. Benchmark analysis indicates that a client has received genetic testing results revealing a specific biomarker associated with an increased predisposition to a certain condition. The client is seeking guidance from their certified personal medicine coach, CPMC, on how to interpret and act upon this information. Considering the regulatory framework and ethical guidelines for CPMC, which of the following approaches best aligns with professional responsibilities? Option A. Directly interpret the biomarker as a definitive diagnosis of the condition and recommend specific dietary and exercise interventions to mitigate the risk. Option B. Provide a detailed prognosis of the client's future health based on the biomarker, including a timeline for potential symptom onset. Option C. Advise the client that the biomarker is not clinically significant and that they should not be concerned about it, as it is merely a genetic variation. Option D. Explain the general scientific understanding of the biomarker, its known associations with health, and strongly advise the client to discuss these results with their physician for personalized medical interpretation and management. The correct answer is D. Explain the general scientific understanding of the biomarker, its known associations with health, and strongly advise the client to discuss these results with their physician for personalized medical interpretation and management. Explanation. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to interpret and communicate complex biomarker information to a client in a way that is both understandable and actionable, while strictly adhering to the ethical and regulatory guidelines governing their practice within the specified jurisdiction. The core challenge lies in balancing the client's desire for personalized health insights with the CPMC responsibility to avoid overstepping professional boundaries, providing medical advice, or making diagnostic claims. The significance of biomarkers in personal medicine necessitates a nuanced approach that respects the client's autonomy and promotes informed decision-making without creating undue anxiety or false expectations. The correct approach represents best professional practice because it prioritizes client education and empowerment within the defined scope of a CPMC role. By focusing on explaining what the biomarker signifies in a general health context, its potential implications for lifestyle choices, and the importance of consulting with a qualified healthcare provider for medical interpretation and diagnosis, the CPMC acts ethically and within regulatory boundaries. This approach upholds the principle of informed consent and client autonomy, ensuring the client understands that the CPMC role is supportive and educational, not diagnostic or prescriptive. This aligns with the ethical imperative to practice within one's competence and to refer to appropriate medical professionals when necessary, a cornerstone of responsible coaching practice. Incorrect approaches fail to meet professional standards due to several regulatory and ethical violations. One incorrect approach might involve directly interpreting the biomarker's results as a diagnosis or a definitive indicator of a specific disease. This constitutes practicing medicine without a license, a serious regulatory offense, and violates the ethical principle of not exceeding one's scope of practice. Another incorrect approach could be to dismiss the biomarker's significance entirely, thereby failing to provide the client with potentially valuable, albeit general, health information that could inform lifestyle choices. This could be seen as a failure of professional duty to support the client's health journey. A third incorrect approach might involve making definitive predictions about future health outcomes based solely on the biomarker, which is speculative, potentially misleading, and ethically unsound, as it can create false hope or unnecessary fear. The professional decision-making process for similar situations should involve a clear understanding of the CPMC scope of practice, the specific regulatory framework governing their work, and a commitment to ethical conduct. When presented with biomarker information, a CPMC should first ascertain the client's understanding and expectations. They should then focus on providing general educational context about the biomarker, its role in health, and common associations, always emphasizing that this information is not a substitute for professional medical advice. The critical step is to clearly and consistently guide the client towards consulting with their physician or other qualified healthcare providers for personalized interpretation, diagnosis, and treatment plans. This tiered approach ensures that the client receives comprehensive care and that the CPMC operates responsibly and ethically. Question 15. The assessment process reveals a client with a diagnosed chronic condition who is interested in exploring personalized medicine approaches, specifically genetic testing, to potentially optimize their treatment plan beyond their current physician's recommendations. The client presents a report from a direct-to-consumer genetic testing service suggesting certain genetic predispositions that they believe should alter their current medication regimen. Which of the following actions by the Certified Personal Medicine Coach, CPMC, best aligns with regulatory frameworks and ethical best practices for this situation? Option A. Recommend that the client immediately discontinue their current prescribed medication and initiate a new regimen based solely on the direct-to-consumer genetic report suggestions for personalized interventions. Option B. Advise the client to discuss the genetic report and their personalized medicine interests directly with their treating physician, emphasizing that the physician will integrate this information into their clinical decision-making process alongside other diagnostic and treatment data. Option C. Encourage the client to pursue additional, unvalidated personalized medicine therapies suggested by the genetic report, without requiring consultation with their physician, to explore all potential avenues for treatment optimization. Option D. Interpret the genetic report independently, cross-referencing it with the client's medical history to provide the client with a definitive personalized treatment plan that bypasses the need for further physician consultation. The correct answer is B. Advise the client to discuss the genetic report and their personalized medicine interests directly with their treating physician, emphasizing that the physician will integrate this information into their clinical decision-making process alongside other diagnostic and treatment data. Explanation. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to navigate the distinct yet potentially overlapping domains of personalized medicine and traditional medical approaches. The CPMC must understand the limitations and strengths of each, ensuring that their guidance complements, rather than contradicts or undermines, established medical care. The core challenge lies in accurately assessing the client's current medical status and ensuring that any personalized medicine recommendations are integrated safely and effectively within their existing treatment plan, respecting the scope of practice for both the coach and the healthcare providers. The correct approach represents best professional practice because it prioritizes client safety and adherence to regulatory frameworks governing health coaching and personalized medicine. By emphasizing collaboration with the client's physician and ensuring that personalized medicine interventions are evidence-based and align with current medical understanding, The CPMC upholds their ethical obligation to act in the client's best interest. This approach respects the physician's role as the primary medical decision maker and ensures that personalized medicine strategies are not pursued in isolation, thereby mitigating risks of adverse interactions or ineffective treatments. This aligns with the general principles of responsible health guidance, which advocate for informed consent, evidence-based practice, and interdisciplinary collaboration. An incorrect approach that suggests the CPMC should independently interpret complex genetic data to override a physician's diagnosis fails on multiple regulatory and ethical grounds. Firstly, it exceeds the scope of practice for a CPMC, who is not licensed to diagnose or treat medical conditions. Secondly, it disregards the physician's expertise and the established hierarchy of medical authority, potentially leading to dangerous self-treatment or non-adherence to prescribed therapies. This constitutes a failure to uphold professional boundaries and a direct risk to client well-being. Another incorrect approach, which involves recommending unproven or experimental personalized medicine interventions without robust scientific backing or physician consultation, is ethically unsound and potentially violates guidelines related to evidence-based practice. This could expose the client to financial exploitation, false hope, and physical harm if the interventions are ineffective or detrimental. It also fails to acknowledge the importance of rigorous scientific validation before widespread adoption of any medical approach. The professional decision-making process for similar situations should involve a clear understanding of the CPMC scope of practice, a commitment to evidence-based guidance, and a strong emphasis on interprofessional collaboration. When faced with a client seeking personalized medicine advice, the CPMC should first ascertain the client's existing medical conditions and treatments. They should then encourage open communication between the client and their physician regarding any personalized medicine interests. Recommendations should always be framed as supplementary information to be discussed with the medical team, never as directives or replacements for medical advice. The CPMC role is to empower the client with knowledge and facilitate informed discussions with their healthcare providers, ensuring that personalized medicine is integrated responsibly within their overall health management. Question 16. Compliance review shows that a certified personal medicine coach, CPMC, is working with a client who has a history of a cardiac condition. The client is highly motivated and expresses a strong desire to immediately begin a rigorous, high-intensity training program to achieve rapid fitness gains. The coach has access to the client's general health information, but has not recently consulted with the client's cardiologist. What is the most appropriate course of action for the CPMC in this situation? Option A. Advise the client to start with a generic, moderate-intensity exercise program that is generally considered safe for most individuals, without further specific medical consultation. Option B. Obtain medical clearance from the client's cardiologist and collaborate with them to design a safe and progressive exercise program tailored to the client's current fitness level and cardiac history. Option C. Focus exclusively on the client's stated desire for rapid progress and encourage them to push their limits, assuming their motivation will override any potential health risks. Option D. Immediately implement a high-intensity training program as requested by the client to capitalize on their motivation and perceived readiness for rapid progress. The correct answer is B. Obtain medical clearance from the client's cardiologist and collaborate with them to design a safe and progressive exercise program tailored to the client's current fitness level and cardiac history. Explanation. Scenario analysis. This scenario presents a common challenge for personal medicine coaches, balancing client autonomy and the desire for rapid progress with the ethical and regulatory imperative to provide safe and evidence-based exercise prescriptions. The client's enthusiasm for an aggressive training regimen, coupled with a history of a specific medical condition, necessitates a cautious and informed approach. The coach must navigate the potential for overexertion and injury while respecting the client's goals and motivation. Correct approach analysis. The most appropriate approach involves a thorough assessment of the client's current fitness level, a review of their medical history, and consultation with their healthcare provider. This aligns with the core principles of personalized medicine and the ethical guidelines for health professionals, which emphasize client safety, informed consent, and collaboration with the medical team. Specifically, the Certified Personal Medicine Coach, CPMC, framework mandates that coaches operate within their scope of practice, which includes recognizing the limitations of their expertise and seeking appropriate medical clearance when a client presents with pre-existing conditions or expresses interest in high-intensity training. This collaborative approach ensures that the exercise prescription is tailored to the individual's physiological capabilities and medical status, minimizing risks and maximizing benefits. Incorrect approaches analysis. Recommending an immediate high-intensity program without further assessment or medical clearance is a significant regulatory and ethical failure. Disregards the potential for exacerbating the client's past cardiac condition, violating the principle of do no harm. This approach also oversteps the coach's scope of practice by making an assumption about the client's current cardiovascular health without professional medical input. Suggesting a generic, moderate-intensity program without considering the client's specific goals or the potential impact of their past cardiac history is also problematic. While seemingly safer, it fails to provide truly personalized medicine and may not adequately address the client's desire for more challenging exercise, potentially leading to dissatisfaction or a lack of adherence. It also misses the opportunity to leverage the client's motivation for a more tailored, yet safe, program. Focusing solely on the client's stated desire for rapid progress without adequately addressing the safety implications of their past medical condition is an ethical lapse. It prioritizes client satisfaction over their well-being, which is contrary to the fundamental responsibilities of a health professional. This approach risks overlooking critical health considerations that could lead to adverse events. Professional reasoning. When faced with a client who has a pre-existing medical condition and expresses a desire for an aggressive exercise plan, a certified personal medicine coach must employ a structured decision-making process. This process begins with a comprehensive client assessment, including a detailed review of their medical history and current health status. Crucially, it involves obtaining medical clearance from the client's physician or relevant healthcare provider before initiating any new exercise program, especially one that deviates from standard moderate-intensity recommendations. The coach should then collaborate with the healthcare provider to develop an exercise prescription that is safe, effective, and aligned with the client's goals and medical limitations. This ensures that the coach is acting within their scope of practice, prioritizing client safety, and adhering to the principles of personalized medicine. Question 17. Stakeholder feedback indicates that clients are increasingly seeking guidance on interpreting genetic and genomic test results to inform their personal health strategies. A client presents you with a report from a direct-to-consumer genetic test that highlights a predisposition for a certain condition. As a certified personal medicine coach, what is the most appropriate approach to risk assessment in this situation? Option A. Conduct a comprehensive risk assessment that integrates the genetic findings with the client's full health profile, including lifestyle, family history, and existing medical conditions, and recommend consultation with a qualified healthcare professional or genetic counselor for interpretation and further guidance. Option B. Advise the client on specific dietary changes and exercise regimens directly based on the genetic predisposition identified in the report. Without further medical consultation, Option C. Provide a detailed interpretation of the genetic markers and their implications for disease development, offering a prognosis based solely on the genetic data. Option D. Inform the client that direct-to-consumer genetic tests are unreliable and that the results should be disregarded entirely, focusing only on general wellness advice. The correct answer is A. Conduct a comprehensive risk assessment that integrates the genetic findings with the client's full health profile, including lifestyle, family history, and existing medical conditions, and recommend consultation with a qualified healthcare professional or genetic counselor for interpretation and further guidance. Explanation. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to navigate the complex intersection of genetic information, individual risk assessment, and the ethical imperative to provide guidance without overstepping professional boundaries or making medical diagnoses. The CPMC must balance the potential benefits of genetic testing for personalized health strategies with the inherent uncertainties, potential for misinterpretation, and the need for qualified medical oversight. Careful judgment is required to ensure that the information provided is accurate, actionable within the CPMC scope of practice, and respects the client's autonomy and understanding. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment that considers the client's full health profile, not solely genetic predispositions. This aligns with the ethical guidelines for health coaching, which emphasize a holistic view of well-being and the importance of integrating genetic information with lifestyle, environmental factors, and existing health conditions. By recommending consultation with a qualified healthcare professional or genetic counselor, the CPMC ensures that the complex interpretation of genetic results and any subsequent medical decisions are handled by those with the appropriate expertise, thereby adhering to the principle of not practicing medicine without a license and upholding client safety. This approach also respects the client's right to informed decision-making by facilitating access to expert interpretation. An incorrect approach that focuses solely on the genetic test results without considering the client's broader health context is professionally unacceptable. This failure stems from a lack of holistic assessment, potentially leading to an overemphasis on genetic risk factors while neglecting other significant contributors to health outcomes. Ethically, this could result in undue anxiety or a false sense of security for the client. From a regulatory standpoint, a CPMC providing definitive interpretations or recommendations based solely on genetic data without medical consultation could be construed as practicing medicine without a license, a violation of professional scope of practice regulations. Another incorrect approach that involves directly advising on specific medical interventions or treatment plans based on genetic findings is a clear regulatory and ethical failure. This directly crosses the line into medical practice, which is outside the CPMC scope. Such actions would violate regulations governing the practice of medicine and could lead to harm if the advice is inappropriate or misaligned with the client's actual medical needs. A third incorrect approach that dismisses the relevance of genetic testing entirely, without a thorough understanding of the client's concerns or the potential benefits of such information when properly interpreted, is also professionally suboptimal. While caution is warranted, outright dismissal can hinder a client's proactive health management and may not align with the evolving landscape of personalized medicine. Ethically, it fails to fully support the client's pursuit of health information. The professional decision-making process for similar situations should involve a structured approach. First, understanding the client's specific concerns and goals related to genetic testing. Second, assessing the client's current health status and relevant medical history. Third, evaluating the potential benefits and limitations of genetic testing in the context of the client's situation. Fourth, determining the appropriate scope of the CPMC role, which typically involves facilitating understanding, supporting informed decision-making, and guiding clients to appropriate resources. Finally, and crucially, recommending consultation with qualified healthcare professionals or genetic counselors for interpretation of results and medical advice, ensuring that the client receives comprehensive and safe guidance. Question 18. System analysis indicates a certified personal medicine coach, CPMC, is working with a client who expresses significant apprehension about performing overhead pressing movements due to a past shoulder injury that resulted in pain and a feeling of instability. The client explicitly states they want to avoid any exercises that involve lifting weights directly overhead. CPMC has conducted an initial assessment and believes the client has the current range of motion and strength to perform modified overhead presses safely, provided proper technique and gradual progression are implemented. How should the CPMC proceed in designing the exercise program? Option A. Design a program that avoids overhead pressing, but also omits other upper body pushing exercises that might indirectly stress the shoulder joint, focusing instead on lower body and core work to accommodate the client's perceived limitation. Option B. Conduct a detailed movement assessment to identify the specific biomechanical factors contributing to the client's past pain and instability, educate the client on the findings, and collaboratively design a program that includes modified overhead pressing exercises with a focus on controlled execution and gradual progression, while also offering alternative upper body pushing exercises. Option C. Exclude all overhead pressing movements from the program entirely, as per the client's direct request, and focus solely on other upper body pushing exercises that do not involve lifting weights overhead. Option D. Insist on performing standard overhead presses as part of the program, explaining that the client's past injury is irrelevant to their current capabilities and that they must push through any discomfort to regain strength. Correct answer is B. Conduct a detailed movement assessment to identify the specific biomechanical factors contributing to the client's past pain and instability, educate the client on the findings, and collaboratively design a program that includes modified overhead pressing exercises with a focus on controlled execution and gradual progression, while also offering alternative upper body pushing exercises. Explanation. This scenario presents a common implementation challenge for a certified personal medicine coach, CPMC, when designing a personalized exercise program. The core difficulty lies in balancing the client's stated preferences and perceived limitations with evidence-based best practices and the CPMC professional responsibility to ensure safety and efficacy. The client's desire to avoid certain movements due to past negative experiences, even if not medically contraindicated, requires careful navigation. CPMC must not only consider the client's psychological comfort, but also their physical well-being and long-term adherence. The challenge is to create a program that is both effective and sustainable, respecting the client's autonomy while upholding professional standards. The correct approach prioritizes a thorough, evidence-based assessment that addresses the client's concerns directly and educates them on safe alternatives or modifications. This involves a detailed movement assessment, understanding the root cause of their past negative experiences, and collaboratively developing a program that gradually reintroduces or modifies movements. This aligns with the CPMC ethical obligation to provide competent and individualized care, ensuring programs are safe, effective, and tailored to the client's unique needs and circumstances. It also fosters trust and empowers the client through education and shared decision-making, promoting long-term adherence. An incorrect approach that solely relies on the client's stated avoidance without further investigation fails to uphold the CPMC duty of care. It risks creating a program that is suboptimal, potentially limiting the client's progress and overall fitness potential. This approach could be seen as a failure to adequately assess the client's physical capabilities and needs, potentially leading to a program that does not address underlying issues or provide comprehensive benefits. Another incorrect approach that dismisses the client's concerns outright, insisting on a program that ignores their past negative experiences, is ethically problematic. This disregards the client's subjective experience and can lead to fear, anxiety, and non-adherence. It demonstrates a lack of empathy and a failure to build rapport, undermining the therapeutic relationship. Such an approach could be considered a breach of professional conduct by not adequately considering the client's psychological state and its impact on their ability to engage with the program. A third incorrect approach that blindly follows the client's preferences without any professional oversight or modification, even if those preferences are not aligned with safe or effective exercise principles, is also unacceptable. This abdicates the CPMC responsibility to guide and ensure the client's safety and progress. It could lead to ineffective training or even injury if the client's preferences are inherently risky or counterproductive. The professional decision-making process should involve a systematic approach. First, active listening and empathetic understanding of the client's concerns. Second, conducting a comprehensive assessment to gather objective data on their physical capabilities and limitations. Third, educating the client about their findings and potential solutions, including modifications and alternative exercises. Fourth, collaboratively designing a program that incorporates their feedback while adhering to evidence-based principles. And finally, ongoing monitoring and adjustment of the program based on the client's response and progress. Question 19. The audit findings indicate that a certified personal medicine coach, CPMC, received a request from a client's adult child to share detailed personal medicine information with them, stating it was to help coordinate care. The client has not explicitly authorized this disclosure to the child, though they have generally discussed their health with family. The coach is aware that the child has expressed strong opinions about the client's treatment choices in the past. What is the most ethically sound and regulatory compliant course of action for the CPMC? Option A. Discuss the adult child's concerns with them directly and offer advice on how the client should manage their treatment, based on the coach's understanding of the client's situation. Option B. Obtain explicit, written consent from the client, specifically authorizing the disclosure of personal medicine information to their adult child for care coordination purposes, and clearly define the scope of information to be shared. Option C. Share the information with the adult child explaining that it is for care coordination and that the client generally discusses their health with family. Option D. Inform the adult child that the coach cannot share any information due to privacy regulations without further discussion with the client. The correct answer is B. Obtain explicit, written consent from the client specifically authorizing the disclosure of personal medicine information to their adult child for care coordination purposes, and clearly define the scope of information to be shared. Explanation. The audit findings indicate a potential breach of client confidentiality and a conflict of interest, which are core ethical considerations for a certified personal medicine coach, CPMC. The professional challenge lies in balancing the client's immediate desire for information with the coach's ethical and regulatory obligations to protect sensitive health data and avoid situations that could compromise their professional judgment or the client's best interests. Careful judgment is required to navigate these competing demands. The correct approach prioritizes the client's privacy and the integrity of the coaching relationship by adhering strictly to data protection regulations and ethical guidelines. This involves obtaining explicit, informed consent before sharing any information, even with a family member, and clearly delineating the boundaries of the coaching relationship. This approach upholds the principle of client autonomy and confidentiality, which are fundamental to the CPMC role and are likely reinforced by the specific regulatory framework governing CPMC. An incorrect approach that involves sharing the client's personal health information with a family member without explicit, documented consent represents a significant breach of confidentiality. This failure directly violates data protection laws and ethical codes that mandate the secure handling of sensitive personal data. Another incorrect approach, which involves the coach using their access to the client's information to influence a family member's decision about the client's care, creates a clear conflict of interest. This action undermines the coach's impartiality and could lead to decisions that are not in the client's best interest, violating ethical principles of beneficence and non-maleficence. A third incorrect approach, which is to dismiss the family member's concerns without proper investigation or communication, fails to acknowledge the potential for legitimate family involvement and could damage the client's support system, while also potentially overlooking critical health information. Professionals should employ a decision-making framework that begins with identifying the ethical and regulatory principles at play. This involves recognizing potential conflicts of interest, understanding data privacy obligations, and prioritizing client autonomy and well-being. Next, professionals should gather all relevant facts, including the client's wishes and the family member's concerns. They should then consult relevant ethical codes and regulatory guidelines. Finally, they should communicate transparently with the client, obtain informed consent for any actions taken, and document all decisions and communications thoroughly. Question 20. Process analysis reveals that a certified personal medicine coach, CPMC, has completed a comprehensive personalized health assessment for a client, which includes genetic data, lifestyle factors, and biometric readings. The client is seeking guidance on how to interpret these results to optimize their well-being. Considering the CPMC role, which of the following approaches best aligns with regulatory and ethical best practices for personalized health coaching? Option A. Dismiss the personalized health assessment data as too complex and revert to providing generic, widely accepted health and wellness advice. Option B. Directly interpret the genetic predispositions as definitive health risks and prescribe specific dietary and exercise regimens to mitigate these identified risks. Option C. Present the personalized health assessment findings as absolute truths and strongly encourage the client to make immediate, drastic lifestyle changes without consulting their physician. Option D. Synthesize the assessment findings to identify potential areas for lifestyle adjustments and educational opportunities, empowering the client to discuss these insights with their healthcare provider for medical interpretation and guidance. The correct answer is D. Synthesize the assessment findings to identify potential areas for lifestyle adjustments and educational opportunities, empowering the client to discuss these insights with their healthcare provider for medical interpretation and guidance. Explanation. This scenario is professionally challenging because it requires a certified personal medicine coach, CPMC, to navigate the nuanced boundaries between providing personalized health insights and offering medical advice, which falls outside their scope of practice. The core of the challenge lies in interpreting complex genetic and lifestyle data to inform personalized recommendations without making diagnostic or treatment claims. Careful judgment is required to ensure that recommendations are evidence-based, aligned with the individual's stated goals, and do not overstep regulatory boundaries. The correct approach represents best professional practice because it prioritizes client autonomy and safety by focusing on education and empowering informed decision-making. It involves synthesizing information from the personalized health assessment to identify potential areas for lifestyle modification or further discussion with healthcare providers. This aligns with the ethical imperative for CPMC to operate within their defined scope, which emphasizes coaching and support for health-related behaviors rather than medical intervention. Specifically, it adheres to guidelines that mandate CPMC to refer individuals to qualified healthcare professionals for any medical concerns or diagnoses, thereby upholding regulatory compliance and client well-being. An incorrect approach that involves directly interpreting genetic predispositions as definitive health risks and prescribing specific dietary or exercise regimens based solely on this interpretation represents a significant regulatory and ethical failure. This crosses the line into medical advice, which is the domain of licensed healthcare practitioners. Such an approach could lead to misinterpretation of health status, unnecessary anxiety for the client, and potentially harmful self-management decisions. It violates the principle of operating within one's scope of practice and could expose the CPMC to legal repercussions for practicing without a license. Another incorrect approach, which is to dismiss the personalized health assessment data entirely due to its complexity and revert to generic health advice, is also professionally unacceptable. While it avoids overstepping boundaries, it fails to leverage the unique insights provided by the assessment to offer truly personalized coaching. This approach neglects the client's investment in the assessment and the potential for targeted, effective interventions. It represents a failure to provide the value expected of a CPMC and can lead to client dissatisfaction and a lack of progress. A third incorrect approach, which is to present the personalized health assessment findings as absolute truths and encourage the client to make drastic lifestyle changes without considering their current health status or consulting with a healthcare provider, is ethically unsound and potentially dangerous. This approach lacks the necessary professional caution and fails to acknowledge the multifactorial nature of health. It can lead to unintended consequences, such as nutrient deficiencies or overexertion, and undermines the collaborative relationship between the client, the CPMC, and their medical team. The professional decision-making process for similar situations should involve a clear understanding of the CPMC scope of practice, a commitment to ongoing professional development to stay abreast of relevant guidelines, and a robust framework for client assessment and referral. When faced with complex data, the professional should ask, does this require medical interpretation or diagnosis? If the answer is yes, a referral is mandatory. If the answer is no, the focus should be on translating the information into actionable, personalized coaching strategies that empower the client to engage with their healthcare providers and make informed lifestyle choices. The process should always prioritize client safety, ethical conduct, and regulatory compliance.